Hey girl, hey, let me ask you something. Have you ever looked in the mirror and thought, why is my skin doing that? Or pulled out more hair than usual in the shower and had a mini panic attack about it? Or woken up at 2 or 3 a.m. for no reason and then had your brain spiral? Or had your doctor tell you that your labs looked fine even though you felt like hot buttered ass? And you walk out feeling worse than when you walked in. Girl, I am here to tell you that a lot of what we write off as aging or have been taught to write off as aging or just life is a very specific biological explanation. Most of it traces back to one hormone, and that hormone is estrogen. And today we are going to go deep on it, what it is, what it does, and what happens to your body when it starts to fluctuate. If you've watched video 24, the overview of what perimenopause does to your hormones, you already know that estrogen doesn't just drop. It fluctuates, and it surges, and it crashes, and it feels like a roller coaster. And it does this for years before it finally stabilizes at a lower level. This video is the deep dive. Welcome in. Because estrogen, not a simple hormone. And most of us, I'm guessing, were never really given an actual explanation on what it does. Lord knows I'm still learning. If this is your first video in the series, hey girl, hey, welcome. This one's going to stand on its own. First, let's get accurate about something, because estrogen is not actually one hormone. Estrogen's a class of hormones, 3 main types. Estradiol is the one that matters most in your reproductive years. It's the most potent, the most abundant, made primarily in your ovaries. And this is the one that runs the show, and the one that starts fluctuating in perimenopause. Next is estrone, and it is made of fat tissue. It has a weaker effect, and after menopause, when the ovaries have stopped producing estradiol, estrone becomes the main estrogen that your body still makes. Estriol is the estrogen of pregnancy, present in tiny amounts otherwise. When you hear clinicians talk about estrogen, if you do, they're predominantly talking about the combined effects of all 3. But when we talk about what's happening in perimenopause, we are mostly talking about estradiol. Here's the thing about estradiol that most of us weren't taught, haven't heard, didn't learn, didn't read in a book. It's been called the master regulator of the female brain. Sit with that for a second. Not the reproductive system, the brain. Your brain runs on estrogen. There are estrogen receptors in every major brain region. In the prefrontal cortex, which handles decision-making, focus, and planning. In the amygdala, which is your emotional center. In the hypothalamus, hang on, because this one regulates body temperature, appetite, and sleep. Putting it together yet? Estradiol supports neuroprotection, aka brain protection. It boosts serotonin, which is your mood-boosting, mood-balancing neurotransmitter. And it helps your brain use glucose efficiently for energy. It's been described as nature's antidepressant. Who knew? So when estradiol starts to fluctuate, guess what? I'm sure you already know this, but your brain feels it first. Now let's talk about where else estrogen shows up in your body, because the reason perimenopause symptoms are so all over the place is that estrogen receptors are quite literally all over the place, all over your body. Hair. Estrogen supports collagen and keratin production, the texture, the thickness, the growth rate of your hair. When it starts declining, hair can thin, you can shed more, it can change texture, and it can affect your eyebrows and your eyelashes. Skin, same mechanism, collagen and hydration. Research shows we can lose up to 5% of our collagen production per year once estrogen starts declining. That's scary for me. Which shows up as dryness, less elasticity, and slower wound healing. Eyes. Did you know this? Estrogen lubricates your eyes. Estrogen lubricates tissues. Dry eyes in perimenopause, guess what, girl? Estrogen. Changes in vision or blurriness, also estrogen. Estrogen affects the stiffness of your cornea. Ears? Yep, estrogen receptors in your inner ear. Hello, tinnitus, ringing of the ears, sometimes vertigo, all estrogen. Now onto the cardiovascular system, and this one is critical. Estrogen helps release nitric oxide, which dilates your blood vessels and improves blood flow in your body. It helps your heart's electrical nodes stay in sync. And when estrogen becomes volatile, you can get heart palpitations that seem to come from nowhere. In 2020, the American Heart Association declared menopause an independent risk factor for heart disease, meaning the estrogen decline that began in perimenopause on its own raises your cardiovascular risk. Heart disease is the #1 killer in women. This is not a small footnote here. Bones. Did you know your bones have estrogen receptors too? I'm sure at this point you're not surprised, but estrogen signals your bone-building cells to do their job and keeps your bone-breaking cells in check. When estrogen shifts, that balance shifts. Bone loss accelerates, and that is why women are more likely to experience a serious fracture, from osteoporosis to have a cardiovascular event, a stroke, breast cancer diagnosis, combined. Gut, your gut. So, as estrogen declines, the bacterial population of your gut shifts. Digestion slows. You may notice more bloating, more constipation, or changes in how food sits with you in general. Vaginal tissue. Are you ready for this? The vagina has the highest concentration of estrogen receptors in the body. So, when estrogen fluctuates or drops, your tissues start to thin, the moisture decreases, and the pH shifts. Vaginal dryness, painful sex, increased UTIs. This is the genitourinary syndrome of menopause, and it can start in perimenopause. And this is not a matter of if, it's a matter of when. Okay, joints and muscles, joint pain, stiffness, decreased muscle mass. There's now a recognized condition called musculoskeletal syndrome of menopause, and it starts in perimenopause. Brain fog, mood changes, memory lapses. Those are all estrogen symptoms. Estrogen supports serotonin. So when estrogen becomes volatile, serotonin takes a hit. God help us. And when serotonin takes a hit, your mood, your sleep, and how good you feel just on the general day all takes a hit. Estrogen is also anti-inflammatory in the brain. So important. So when it drops, neuroinflammation can increase. And neuroinflammation is one of the mechanisms that's thought to be behind brain fog in perimenopause. But here's the good news. Recent research has shown that about 80% of women will regain cognitive function after hormones stabilize. The brain fog is absolutely real, as I'm sure you know. Good news, for most of us, it's temporary. All right, the difference between perimenopause, brain fog, and cognitive decline. You ready? Perimenopause brain fog looks like trouble finishing tasks, walking into a room, not remembering why you walked into the room, forgetting words mid-sentence, difficulty concentrating on a book, on a conversation, that kind of thing. What's different from early cognitive decline is that perimenopause brain fog is inconsistent and tied to hormone fluctuations. It shifts. It's not forgetting your way home or names of people that are close to you. But I also want to say that if this is scaring you, that's a valid fear, and getting informed is the best move here, because the long-term effects of brain health implications of estrogen decline are very real and very much worth paying attention to. So, in perimenopause, estrogen surges before it drops. The chaos is the problem, not just the direction. Here's a piece of this that most content gets wrong. When most of us picture estrogen in perimenopause, we visualize it dropping. We imagine that it's dropping. But especially in the early years of perimenopause, it can actually spike. It can surge. And it does. And sometimes to levels 30% higher than your fertility years, and then crash, and then spike again. Great. On a high estrogen day, you may have breast tenderness so bad that you wonder if you're pregnant, and you wonder what the hell. And a few days later, on a low estrogen day, you're bloated, constipated, blue, and dragging yourself through the afternoon, ready to go to bed. Same body, same week, completely different hormonal environment. And this is why treatments for postmenopausal women who have low and stable estrogen levels don't always work in perimenopause. It's a whole different phase. The goal isn't just to add more, the goal is to address the instability. I want to read you something. Dry skin, thinning hair, ringing ears, blurry vision, joint pain, heart palpitations, bloating, brain fog, mood swings, low libido, weight gain, around the middle, waking at 2 or 3 a.m., anxiety that came from nowhere, mouth that feels dry, nails that break easily. Every single one of those has estrogen written all over it. And most of us are told that these things just happen. Some of us have just given up and accepted that. Maybe it's stress, maybe it's age, maybe I need more water, maybe I need more sleep. These are not crazy random things that are happening to you. They're hormonal signals, and they can start in your 30s. I was never okay with compiling a list this long, talking to a doctor, and getting zero explanation. None of us are. None of us are okay with that. If you've made it this far, I know you're not. But that is exactly why I'm here. That is why I'm running this series. That is why I'm doing this research. Estrogen, not just a reproductive hormone. In fact, that's not its primary goal. It's a whole body hormone, girl. It runs your brain. It runs your heart. It runs your bones. It runs your gut. It runs your skin, your mood, and your sleep. And when it starts to fluctuate in perimenopause, all of those symptoms start showing up in your systems, often at the same time, which can be very destabilizing and make you start to question your sanity. And that can feel very disorienting. Coming up next in the series is progesterone, the calming hormone, the one that declines first, and the one that explains a lot about anxiety, the insomnia, and that feeling that your nervous system is running on fumes. If this helped something click into place for you, subscribe, leave a comment. Tell me what symptom hit you first, when, where. I want to hear your stories. I read all of them. I will respond to all of you. And if you know a woman, if you know one of us who's been handed symptoms or a symptom and sent home without an answer, send her this. Do her a solid. And if you haven't done something to love yourself today, girl, please go do that. And if you don't know what that looks like, drop me a message. I will help you out. Until next time, all my love.